Okay, our next speaker is Deborah Kendi from SuperFriend, and I need to tell you, you need to read Deb's bio. She's had such a diverse work life. I think I should have a glass of wine with you after this, Deb, and talk about all the things you have done. But Deb's the Program Development Officer with SuperFriends and works in trialling workplace programs to support employees in dealing with mental health at work. So please make Deborah welcome.
Okay. Hi, everyone. It's been mentioned a couple of times that we're facing a room that is predominantly men, and I've worked for a long time in social health and relevant areas, and it's always been a sea of women. And I think that that's telling in itself, that working in the health field, we tend to be more talking to women, so it's great to see a room full of men. Okay, to start with, I'll just explain a little bit about who SuperFriend is. SuperFriend is a mental health foundation that was established 70 years ago by the Industry Funds Forum. The Industry Funds Forum is an independent, non-political organisation made up of the heads of 28 industry super funds. The reason that they established SuperFriend was that they were particularly concerned about suicide rates. They see them every day, as Chris just illustrated with some film there. Not only the suicides, but the mental illness claims and the damage that's caused for families, communities and work sites. And they were very concerned about that and wanted to do something directly for members, so they established SuperFriend. Oops, I better go back. That's all our sponsors. Those are our, yeah, thanks. That's our supporting partner funds. So you can see we're supported by a lot of the biggest funds, and particularly by CBUS, and I want to make a special mention of CBUS, not only because they've been fantastic supporters of us through our programs, but for the last 7 years we've been co-hosted and co-located within CBUS at no cost to us, and that's enormous. They've paid for absolutely everything for what was up until November 7 people, and is now 11 people because we're growing, but we've just moved out. We grew up and left. So that really just tells you why. So it was about reducing the incidence of suicide. It was about working through workplaces. So we were primarily set up to provide information and support. And as things have gone along, that's changed and grown. So we do provide information and support, but we're not a service provider. We're not a direct service provider. We're a facilitator. So we work with the mental health industry, and we work with our funds and our supporting partners. And we focus on development and promotion and a lot of sort of trialling and research. We're funded by the supporting partner group insurers that insure the industry funds. So the funds don't pay us directly. We get the equivalent of a small percentage of the premiums that go to the funds from the insurers. And we greatly appreciate that from the insurance sector. And we also have these supporting pro bono supporters who provide a lot of fantastic advice and expertise to us. One of the things I wanted to mention at this stage, which I'm not going to cover later, and I know I'm going to run out of time, is Supermind. We're doing a project at the moment with all of the insurers and with our funds to look at claims data. It's an absolutely enormous, it'll be about a 10-year project, but to try to get some common claims data around mental illness and suicide. So with mental illness as a primary and secondary cause of claim, and looking then to see what further information we can get about the profile of where those claims are coming from. So actually looking at cluster data, geographic data, skills data, setting data. So over time, hopefully we'll be able to do that and just improve their quality of their data, because it's very diverse and gathered quite differently. Just to show you how we work with our partner funds very, very closely. So I work with people like Graham, who was just on the video a minute ago, and they link us in with employers. So we develop programs and we work with our funds through the coordinators at the funds, and they bring us into an employer. They have a very trusted relationship with their employers, and so when they do that, when they say, look, we've got these people from SuperFriend who can come in and have a chat with you about, you know, how to address mental health or mental health and safety in the workplace, which is the sort of terminology they tend to use. Employers are pretty open to that, the people that we talk to. And we usually find that we sort of get bumped up. We might go in and meet with an HR manager who'll say, this is pretty interesting, like, you should come and talk to another manager. And so we end up talking to some pretty influential people in the workplace. We then engage the mental health provider, so you can see we're linked into the provider there, and then we work with the member employer. So through the fund to the member employer and bringing the mental health together. A lot of what we do is we use a business case to do that. So we don't have costs of suicide, but we do look at the costs of claims. We usually can work with the fund to get some claim data about the organisation before we go in, so they can have a look at what their claims are like. They can look at their own insurance costs, their premium costs, and we can give them some indicators about other data they can collect, like absenteeism and presenteeism. Over the last couple of years, I've been working on these 6 projects, each with different funds and in different sectors, and with different collaborative providers. So you can see we've worked with Sane Australia, Lifeline, Carers New South Wales, University of Melbourne, Peoplescape, and all our funds you can see. The 2 I want to mention are the Working Carers Project, which is the one we did with CBUS and TWU Super, and also the Workplace Mentors Program. The Working Carers Project was extraordinarily difficult. In most cases, it was fairly easy to get to find an employer and work with an employer. We found it really hard in this sector, firstly, to find a topic that would work, because there are so many really fantastic providers already working in this field. And we were didn't want people to think we were a flavour of the month, like a campaign or something. We're actually about doing some piloting and some research. So we looked at the issue of working carers, which is great, and it's a massive issue. And it was brought up to us by the funds, who deal with a lot of people who are caring for other people. And we did, through Master Builders Associations and through the CFMEU, who were very supportive in Victoria, we did talk to people about being carers and about the massive load of work-family interference that is going on with people who are caring for others. The other project I will mention is the Workplace Mentors one, and I think it's because we did that with retail and with shipping, ship's deck crew, and in the manufacturing sector. And it was a fantastic project, and I'll tell you a bit about that in a minute. So we did a literature review in the carer project, which was with construction. We did a literature review. We then did focus groups in workplaces. We developed training, development of resources, and then we did distribution of resources and the training. And initially it was supposed to be workplaces, but I'm sure you'll all understand this. We found that so hard because it's such a moving feast. All the other projects we could work with workplaces, even in transport, we could go into big transport companies and work, but we found it so hard in construction. So we were it was very difficult to sort of work our way through. We ended up working very closely with the CFMEU, who, as I said, were great, and with their OH&S trainers, and looking at their OH&S training and where they could integrate some of the things that we were identifying. So we did the literature review. These are some of the issues that came out of it. So I don't think there's anything that you would consider to be new information there. But in relation to carers, I will tell you, the people that I spoke to, every second person had some sort of caring load. Children with disabilities, family members, ageing parents, etc., as a load on top of the load that they already have in the work they're doing. And I have to say, nobody had a problem talking about it. So wherever I went, if I asked a question, people were very happy to talk about it and to talk about how hard it was. It's also very likely that in this industry, people will cease working if something like that comes up. There's no other alternative. Traditional accommodations around flexibility just don't work in this industry. Lack of attention to male carers, assuming that there's a woman somewhere who will be able to look after that child or parent or whatever, which is absolutely not correct. High work demand, low control, and low supervisor support were all major issues. So we did that work actually with University of Melbourne, and Alison Milner was again involved, and she was fantastic. But then we took it to some groups in the industry, and we had the support of IncoLink also to go in and talk to people who were doing training. And their stories were amazing, really. There's 40 people standing behind me in a queue, and if I can't turn up for work tomorrow, then I'm out the door. People said, there's pamphlets and stuff, but it doesn't really help. But the biggest issue was not being able to tell supervisors. And I think it wasn't just about caring, it was about anything to do with their mental health. So having a good foreman or supervisor was the thing that they said made all the difference. And and the other thing was talking to each other. So talking to OH&S reps, talking to union delegates, obviously talking to mates in construction and IncoLink reps and that sort of thing as well. But they were the 2 big things. And I think we talk a lot about supervisor support and having a good supervisor and what supervisors need to know, not just about mental health, but how to manage, how to be a supervisor. And that's not just in this industry, it's across the board. It's something that just people get promoted to the level of their technical ability, but very rarely promoted to the level of their ability to manage other people. And it's a major gap in the way that we work in every industry. And we found that very much here. That the relationships with supervisors were, you know, one guy said, I had a great relationship with my supervisor. He was a mate, we barbecued on the weekend, my family knew his family, and then my mother got sick and I had to take some time off, excuse me, and he said I was out the door. So that was in relation to caring, in relation to everyday work. Having a good supervisor who can at least understand and sympathise makes a massive difference to people. People are willing to work and do whatever they can if they feel that they're supported and recognised in what they're doing as well. And I just hark back to the no dickheads rule that came up this morning, and I think that requires good supervisors to say, yes, no dickheads. That's where it has to come from. It doesn't come from the people who are working next to each other. It has to come from a supervisor who's not willing to stand for it. One of the other areas that we're working in at the moment is I just met with a sugar co-op in northern New South Wales who had 3 different sites, and obviously really low-skilled blue-collar workers. And the HR manager that I met with, and I go out to sites a lot and run pilot programs, he actually took over from, there was a suicide. The HR manager suicided, and he took over the job, and he's taken their claims from 2.6 million to 1.2 million in 1 year. Because he looked at culture. He looked at behaviours, values, supervisor training and connectedness, and he's done some really amazing work. So the recommendations of the project were these. Increased literacy specific to the male gender norms and to gender role conflicts. So not about feminising the discussion or feminising men, but actually saying it's a different discussion for men. It is a discussion about fatigue and tiredness and drinking and smoking and all those things. They're the symptoms that are seen, that's what needs to be discussed. It's not about necessarily feeling hopeless and isolated. That generally isn't the discussion. The integration of physical and mental health is a major issue. Quite often the physical symptoms are the signs that you would see first with men. And promoting effective pathways. Supervisor training, management training is massive. Improve manager form and capacity to prevent stress and support working carers. OH&S rep and union delegate training, promoting constructive peer-to-peer conversations around stress and mental health, and then resilience and effort recovery. And effort recovery is about recovery outside of work. So rather than going home from work and laying on the couch and having a beer and watching television, that other things are better for recovery than just doing nothing. So I was asked to talk about what we learned. So what we learned is these things up here, really, and I think I've probably covered most of them in what I've been chatting about. SuperFriend does a whole lot of other things, but because it was about what we learnt from that project, that's kind of what I've put up there, and I'm not going to take you through them all because I think they're all pretty clear to everybody in this room. But what I do want to do is just briefly mention the Mentors project that we ran in a few other sectors and a few other work sites that was really incredibly successful. So it supports the work that is being done by Mates and Incolink. I think, you know, it's fantastic work. What we did with this, though, is we went to the employers. So we went to the employers and we got them to work to select people to be workplace mentors for mental health. They were called Superfit Mates, as you can probably see from the name up there. And we organised for On the Line, which is a crisis support service that runs things like Men's Helpline and a few other major lines. And they ran training on how to mentor in the workplace. And it was a fantastic program. The training was a full day, and then they had to come back for half a day after they'd tried it out for a while. And it was fully supported by the employers, the employing organisations. And we're now starting to roll that out. And we're actually negotiating with 3 mine sites in the Pilbara to roll it out up there. And it's not free. The piloting was free. That's what we do. We're funded to do that. But the rollout will not be free. And the employers are very supportive of it. So they are looking for what they can do. So you saw those classifications before, the ISCO classifications, the international ones. So we looked at the classifications that were specific to low-skilled workers for this particular project. Just a couple more. This is actually some things out of the training. So this is just about what mentoring actually is and what it's not. So confidentiality is very big. It's not professional counselling. They're not going to take you to the HR manager. And it was really well accepted by all of those industries. So some of the things that are covered in there, what stops people giving help, what stops people asking for help, et cetera, et cetera. And there's a lot of training around how to have those conversations beyond, are you okay? So it's really about, yeah, mate, that happened to me too. Let me tell you my story. That's not what it's about. It's actually about the other person and how do you support the other person. So this is the what to do, how to do it, and how could you kill a conversation. And a lot of those behaviours in how you can kill a conversation is pretty much what we all do all the time. So I've got a bit of film here from, his name will come up. His name's Daryl Prince. He's from ISS, which is one of the companies that we worked with. So we worked with security guards in this particular instance. And this is the mentor programs. This is him just talking about some of the outcomes.
The next phase of the program, once the training happened, was then these people were identified as mentors in the workplace. And these mentors were then given ongoing support if they came across somebody and didn't quite know how to deal with it, or maybe they were just lacked the courage of taking that first step of asking the question. And so on the line, which is our crisis support centres, then provided some support capability around that. They had a follow-up a month after the training, a face-to-face follow-up session, and they also provided online support for these guys as the mentors to go, well, if you're feeling a bit stuck, or if you haven't practiced this yet, or give us some feedback around some of the issues you're dealing with. The feedback that I've had from the mentors who have participated in that support has been very useful for them. And not everybody's going to use it, of course, but then when you hear, and it was about 2 months in, that I got a direct email from one of the sites, and that email was very powerful because it was actually from one of the operators who wasn't a mentor but their manager, and they just wanted to flag it back to say, look at this story. And the story revolved around one of our employees who was having a hard time, and one of the mentors, just their normal shift supervisor, had realised that they weren't on their game. And once upon a time probably would have just thought, she's having a cranky day. But they used the skills that they learnt from the training. They then asked, is everything going all right? I notice you're not quite on your game. And that's when it all came out. And this employee was close to giving up. And only because that question was asked could that then be escalated. And when escalated back up through the line management, but also through the online support network to say, listen, let's rally around and try and help this individual. I think we've got a problem. Now that shows a level of maturity of the mentor, but also the success of the training. As it happened, this employee was having an incredibly difficult time. Nobody knew about it. Things were falling apart in her personal life. As a consequence, we've managed to give her some time off, wrap her up in some employee assistance counselling, and get her back on her feet. She's now come back to us and said, thanks. And to me, I don't care the cost of the program. I don't care really the challenges that you have to overcome when you introduce this sort of stuff because people are busy. But at the end of the day, we've made a difference to one person's life. And if we've made a difference to one person's life that they've told us about, how many have we affected that we don't know about?
Yeah. You said she was close to giving up. Do you mean you think she was considering suicide?
That was her words she was using to us, yeah.
So, and they're the ones that we're working with in the Pilbara, where they supply every single service in the villages, the mining villages, except the mining. So everything from swimming guard to the supermarket to the bar people, everything. And they're investing in the program. So in terms of what works, systems approaches work. Proactive primary prevention, addressing work-related sources of job stress. It's something that is kind of like the elephant in the room, really. It really it's the big issue. The work stress is there. We're looking at how do we respond, how do we support each other, how do we talk about it, how do we change it is another issue, and one that's beyond what SuperFriend is looking at, unfortunately. Then collaboration within the sector and with academics, practitioners and facilitators like us. So bringing together best practice with the sector and looking at translating research into practice, which is what we do. So the key things I think that I've sort of covered off are all there. I'm very conscious of my 41 seconds. So I'm not going to read them. I'm not going to read them out. But just clicking through, we're also doing some fantastic research at the moment where we're looking at different sectors and we're looking at skills groups. We've just done a survey of 1,000 working Australians. We're getting some absolutely brilliant information back. It's very exciting. We're then testing it with groups in white collar, lower white collar and blue collar, and I think we'll have some fantastic research for next year when you have the second conference. Hopefully I'll be here. And then lastly is just some other projects we're working on that I don't have time to update you on, but zero. So that's it for me. I think I've...